NHS people, why is that no one bothered? Like, there are so many NHS nurses who are YouTubers, they do YouTube every day, they come and tell us this benefit of being an NHS nurse, this and that. Why is it that nobody wants us? Nobody is warning anybody. So it's just like you people just decided that, okay, I will go into NHS and then you guys should just sort yourself out. We should just sort ourselves out. Why is that nobody warned us? Nobody warned us, the upcoming NHS people. Nobody warned us with the little people, upcoming people coming behind you. Nobody told us that this is what we're going to be finding in the NHS. Nobody told us what to expect. Is it good? Is it good? So in this video, I'm going to be telling you the things that were like a rude shock to me. It is still too early to come and tell you things I love about the NHS, things I don't like about the NHS. It is too early. So let's not just start let's start with what was shocking. What shook the shock? What shook us when we got into the NHS? Okay, so as you may have known, I moved into the NHS, or I joined the NHS about a few months now, just few months. I would say I'm about 2 months into NHS now. And I have to tell you, I have to confess, we do this thing so that you don't need to feel the same thing we felt. I'm like the scapegoat for you, don't worry. I'm like the guinea pig. So, getting into the NHS, I know, we are trained, we are nurses, everybody know we are nurses, nursing is the same everywhere. Why didn't anybody warn me about the training? Why didn't nobody warn me about the e-learning? Wait, what is it? I don't know, maybe it's different for everybody. I don't know if everybody is going through what I'm going through, if everybody went through what I went through, because when I joined the NHS, I know maybe I was supposed to have gotten my induction pack or my e-learning started before I actually started working. But I actually started my work before I started my e-learning. So I guess that was what even made everything more complicated for me. Like, I started the job and then they signed me into the learning platform. The Turax, I don't know what you call them, like the Turas. The e-learning I knew back in my care home is, all the normal e-learning, moving and handling, fire, all those normal e-learning. You know what I mean? My normal e-learning. But I got to the NHS and I was bombarded with loads, like packs of e-learning. I'm like, what is going on here? The first time when I started working in dialysis, me that I already knew a little bit of what I was doing, I was almost attempting to administer IV. They were like, no, you cannot. You need to go and do the e-learning. You need to go and do the training. After you have passed all the blah, 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 they will do the competency. After you have passed the competency, then you go for training and they need to sign you off. You will now do 10 practice before they will now allow you to administer intravenous injection. Before they will not allow you to do this, do that. I'm like, okay, all right. We're not warned. You have to go, you have to be signed off for everything. Like, the learning is crazy. I will come home like this and I'm like, look, I have to study this, I have to study that. And I was reading as if I was going back to school. They're going to treat you like you're just coming fresh from wherever you're from and you have no clue, you don't have anything in your brain, and they have to bombard those things into your brain. Maybe because I'm in a specialty. I don't know if that was why it was so difficult. Please, if you're working with the NHS, kindly drop a comment down in the comment section. Please let me know. Is this the standard? Is this like this everywhere that you have to do loads of e-learning? Like the e-learning I did, you would think I'm exaggerating. My instructor actually, she's a clinical instructor. So I was lucky to have a clinical instructor attached to the renal. She's a renal clinical instructor. So she teaches with the starting staff and the medical student and all those people. She printed what I'll have to study. She printed what I have to study. Is like a textbook. Wait, I don't know if you can. Are you seeing? Are you seeing? This is the physical one. This is just the physical one. The one I have to do online. Normally, 2 days I can finish 20-something e-learning when I was in the care home. But this one, it is something that you cannot even buy cut. You cannot even cut corner. I was reading and reading as if I was going back to school. E-learning. was one of the shocker I got when I joined the NHS. It was so overwhelming at the beginning that I didn't even know how to manage my time with everything going on in my life, with my being in school, my YouTube, my just changing a job, moving new house, and then I have to do all the e-learning thing. I'm like, no, I can't deal with this. It was too much. Although it's getting better now, but believe me, even though it's been a few months since I started working with the NHS, I still have things that I still have to learn, that I'm still reading as if I'm back to school. And then you have to get signed up for this, even to do cannulation. I had to get signed off 10 sign off before I was able to start needling patients for dialysis. It is protocol. NHS protocol is this protocol. Especially when you've not done your IV and then you're trying to administer medication, you've just put up a patient, and then for you to give the injection, you need to go and look for someone else to come and administer it for you because somebody has not signed you off. You can withdraw the injection, you can even prepare it, but you cannot just push because of the protocol, and then you need to go and look for another nurse. Although you have to second check anyway, then it is that second nurse that will now administer just because you've not been signed off. So get ready, be prepared. Don't think because you're a nurse where you're from, the moment you just get into the NHS. I don't know how it is where you're going to be starting, but for where I started, where I'm working, they will have to sign you off, and then at some point you start looking like you don't know anything because you've done this, but at the end of the day you cannot just do what you want to do. Does it make sense? A lot of protocol, a lot of e-learning. You're going to have so many things to learn. Another thing is, I didn't know until I got into the NHS. I don't know that the NHS staff generally think we that we're working in the care home or we in the care home, I don't know, for some reason, they just think we don't know anything. Why? Why is it like that? Why does the NHS staff think care home nurses or care home staff, care home workers don't know anything? It's actually shocking to me because I get asked, okay, so where was your last job? Even by my patients, where was your last job? And I say care home, I'll be like, oh, all right. And then you see that they're like, this one. Actually, when you want to go and connect the patient in the machine, and they ask you, where was your last job? And you say it's a care home, they'll be like, Why do NHS staff think care home? I'm not going to say that everybody, but majority of the NHS staff thinks care home nurses or staff does not know anything. Meanwhile, in the real world, although what we do is different, although you have the NHS, they have standard machine, they have so many equipment that I don't even have a clue what they are. But working in a care home staff and care home nurses, they're still experienced. Like, we need to know everything. We need to know everything about tissue, organs, medications. The medications we do in a care home, the medication I will do in one day in a care home, I've not done it in 3 months working in the NHS. Although I'm not working in the ward, so it may be different for people working in the ward. I've not done it in 3 months. The medication in the dialysis is just normal medication, apart from the serious blood transfusions and IV infusions and those ones that we're not even allowed to do in the care home. But the medications we deal with, the medical conditions we deal with every day in the care home, the situations you have to face, that you have to be the team leader, the decisions we make, the thinking we do, the advocacy we do every day in the care home, it is nothing to undervalue. For some reason, please, I'm just trying to correct the mindset that care home staff, we are also nurses and we are qualified. We know what we're doing. It's just that what we're doing is different from, just like when somebody who is working in the theater meets somebody who is working in, let's say, endoscopy. It's different. They are both special in their own way, and nursing has different branches. So please, no, don't stop thinking care home staff are empty coconuts. We're not. We know our stuff as well. So that was one shock I also got, because most people would just think, from a care home, all you do is just medication, change position, dress people. No, there's a lot. There's more to working. I bet some of those people that have even worked in the hospital for years, if they've never worked in a care home, when they come to the care home, I'm sure they will find it difficult as well to adjust to the system and to know things they're supposed to do, because at the end of the day, it is still different setting. So that was one of the shocker I also got when I moved to the NHS. Don't even get me started on talking about the salary. The salary, because I know you'll be like, Gloria, I didn't know the salary was small before you went to apply for the job and you took the job. Yes, I knew. I knew the salary was going to be small. Wait, I'm going to come and do another video if you want to know how much I earned starting with the NHS monthly salary, my shocking and my shocker, and how I'm going to survive on this earth in this UK. Let me know. Wait, why is the salary so small? No, allow me to talk. Please don't say why am I complaining. I'm not complaining. I'm just putting my frustration and I'm just putting it through. So why can't the government just decide that these nurses should be paid better? I know you cannot pay health workers or people who save life, people who work so hard, 12 and a half hours, 12 hours, people who work so hard. I know you cannot quantify what we do with money, but at least the money helps. That is why, one of the reasons why I think NHS will always be short of staff, because there are other more enticing places, more enticing organization out there that will pay you for doing even less than you would do in the NHS. I don't know why the salary is just so small. It just does not make sense. I know over time you get promotion, but you shouldn't have to work so hard for you to live comfortably if you're working that hard. Really, I don't understand. It doesn't just make any sense. I know even if the NHS decide to increase the salary, the private sector, the care homes also will increase their salary because they will not get any staff if they don't. But at least when you're paying this NHS staff, pay something tangible, like pay them for their service and let us work and know that yes, I'm going to be okay after this salary. I know, don't come from, because I made a TikTok video about NHS salary and the amount of roasting I got on that video, the way people dragged me, they were like, it's your job anyway, didn't you know it was this? Why should you be paid higher? Why should you be paid more? Why should you be treated differently? There's nothing bad in us asking to be fairly paid. We are professionals. Out of most of the professional occupation out there, I think nursing in general is still one of the least paid professions. Sincerely speaking, for what we do, have you been to ICU? Have you been to the theater? Have you seen what people are doing in the world? Especially due to this shortage, that brings me to the point of the shortage in the NHS. Like, oh my goodness, the shortage, I was in shock. The shortage, even when you come to a shift and you're very excited, you're like, oh, we're enough staff today, we are happy, the work is going to go smooth. Another unit will phone and say, please, can we borrow somebody, or can you please send someone to us? And then they will rotate the person away again. Although it is not as bad where I am, because they just leave us alone, because when we are short, we are very, very short, because it's not everybody that knows how to work in dialysis. It's not everybody that knows how to dialyze. So even bringing somebody from the ward is of almost no use. The only way we can get somebody to help us is going back to the ward to look for people that have already worked in my units in the past. If they are ready to come and help us, that's the only way we get help. Otherwise, we work short. Like, when I mean chronic ongoing shortage of staff, the NHS is so short. I know there's shortage everywhere, but I don't know. It's actually a bit scary. And actually, people that are moving job just now, or those that are just coming from abroad and coming to the NHS just now, it can be overwhelming just now because the shortage is too much. And if you're in the middle of working short and you don't know, you're still new, you're still trying to find your foot, it is kind of annoying. It is annoying. There's severe shortage of nurses. Severe. When I mean severe, I've spoken with nurses in the other unit and they're like, it's not easy. It is not easy. And then you're working with people who knows they are right, people who want you to even press the buzzer for just flimsy stuff, people who want your attention, people who want you to care for them. Of course, it is their right as nurses. That's what we're there for. But if you're not enough, you cannot just share yourself into four. The shortage is massive within the NHS just now. It is massive. The seniority complex. Like, going into the NHS, I didn't know that there was this. When I first came, some people they call them sister, band 6, band 2. But what is it? What is it? Like, the seniority complex in the NHS, Hey, the banding level, the seniority complex is the lot. Like, you need to be careful so you don't step on people's toe. If you don't address them properly, how you should address them as a sister in the ward. Me, I didn't know. Coming from where I am, no, everybody is just the same. Every nurse, everybody, apart from your manager and your deputy. If you want to respect them, you respect them. It's just everybody's just the same. Although you know that this person has been working here for donkey years, and you want to just accord them that respect, and if they senior you, but in the NHS, everybody have a level, everybody have where they should be, everybody have, if you're band 5, you're a band 5, then there's this band 6, and then there's band 7, and then there are people you start calling sisters. So the seniority, the ranking, the hierarchy is very, very obvious. It is in the NHS that you will know that, oh, okay, well, I'm just I'm just my band 5. God help me. So help me, God. It is the NHS that you'll be reminded that you're not band 6. So it is the NHS that you're going to be reminded that, look, oh, you're not the one ruling this place. Now we they run this thing. Eh? Unlike in the care home where, oh, we're the local champion, we're ruling everything, we're ruling everywhere, like we're telling people things to do. Oh, in the NHS, you'll be told what to do. And it is good. Especially if you're going to a new place, it is a new environment for me. In fact, I'm actually enjoying the fact that I have no much responsibility placed on my neck. I can just hide under other seniors, all the sisters, and be doing, I'm new here. I don't know anything. Can you show me this? I don't know that thing. Please, can you help me this? I'm just hiding under that umbrella just now. But in the NHS, sincerely speaking, you need to know that there's hierarchy. You need to know that you're not band 6, or you're not band 7, you're not band something, you're band something. Okay? You need to get that into your into your knowing. Thank you. T for thank you. The employment process. If you want to switch to the NHS, I've told you my story. Please learn from my story. The process, the protocol. Do this, do that. What this, what that. From the date in which I got my job until the date I started my job was actually about 5 months for no reason, for no obvious reason. For that 5 months, what was I doing? I was not doing anything more than after the interview. Then you go back for what else did I even do for the period? Okay, after the interview, certificate of sponsorship, do your visa, do your pre-employment health check, get your uniform, and start the work. Then police clearance. This took 5 months. 5 months. I know COVID is also an excuse for everything now that is not working, especially in the UK. Just for somebody to type one thing, they'll tell you there's COVID. They're working from home. They're this. So if you're going to be joining the NHS, be ready for the long process. So I'm still advising you, please don't leave your job before you have a start date that you're sure of and say, oh, okay, so time is my start date, then you can go and give your resignation, because the process, everything is not as quick, it's very slow. Things, unnecessary process, protocol. Although working with NHS is fun, I'm enjoying it, I'm learning a lot. If you really love what you do, you feel fulfilled. So I'm not putting you, like, I'm not telling you not to come into the NHS. I'm not telling you things to expect, so that when you start experiencing these things, you'll be like, Gloria told me it's fine, Gloria told me I'm okay. So that is why I'm making this video, so you're ready for when you get into the job. You're not like, what happened? What is this? Another thing that was a shocker to me was the break. What is it about the 30 minutes break each? I know in my former care home, we usually have 2 breaks, 30 minutes each, but it's more flexible. They will tell you from 11:30 to this social time, maybe because, you know, you're the nurse on duty, you're almost in charge of everything. You're even the one that tell people when to go for their break. Coming to this NHS people, they will tell you, Gloria, it's your break time now. Can you please go now? What if I'm not ready to go? If you're not ready, you have to be ready to go when they tell you to go. I don't know, is it like that in other places? But for me, they're not that will tell me when to go for my break. And when you're going for your break, you're not going alone. You're going with other group of people that somebody will even put alarm for exact 30 minutes on the dot. Bing. So when it's 2 minutes to that 30 minutes, they'll start standing up, start preparing, start washing their cup. I'm not even ready to go back yet. Although I'm a very good, obedient staff, but wait, why is the break so strict? What is it? What's going on? Unlike in the care home, although I think the NHS is operating a no smoke policy, because I read it when I was doing my induction thing. No smoke policy, so there's nothing like they'll give 5 minutes to go and smoke. I don't smoke, but people who smoke in the care homes, sometimes somebody will come and tell me, Gloria, please, can I go and have a fag? And you allow them to go, and they will just go. They will just maybe 5 minutes, they're not back. 6 minutes, 7 minutes, it's still a little bit flexible, you know. But in the NHS, it is strict. I don't know how it is where you're working, but where I'm working, break, they'll tell you first break, second break, third break. In fact, they will even group us according to our name on the board. So when it's your time, your group are going, they'll call you, Gloria, it's okay, I'll take over from you. Can you go for your break now? And you go. And when it's time to come back, you all will come back now. Like it is chap chap. There's nothing like 30 minutes and 1 second. What is it? Why is it so strict? That was something that was also a bit shocking to me. Because in the care home, I decide when I want to go for my break. Sometimes I don't even go for my break. I don't even take some breaks. So I don't even take breaks sometimes because if I'm too busy, I rather not take my break than having to wait 1 hour or 2 hours after my work. And then there's no, when I work overtime, somebody pays me. It's like that where you are, where I am just now. Even if you decide to work and you don't finish your work by 30 minutes time, nobody's going to pay for 30 minutes. We don't clock in, we don't clock out. So you come to work, and if you work more than your normal hour, it is in your pocket. Nobody will pay you anything. Unlike in a care home, if you work extra hours, you get paid for the extra hours. Okay, so those are some of the things that were also a bit shocking to me. And then what is it with the time? What is it with the waking up by 7 a.m. and starting work by 7 a.m. thing? Why can't it not just be 8 or 9? I don't know. Please don't come for me. I'm just saying. My former jobs in the care homes, I usually start my work by 7:45, 15 minutes to 8. And it's nice. You can sleep up to 7, up to 6:30, depending on where you're living. But since I started my job, my job starts by 7 and I close by 7:30. So stylishly, I'm working 12 and a half hours. So if I'm working by 7, when am I supposed to wake up? 5:30? And then travel, get ready? It's too early. I don't know why it's so early. So that is something that was also a bit shocking to me. I don't want to bore you too much with my ranting. These are some of the things I think is a bit different from working in the care home, that I can say just now from experience. So I hope you enjoyed this video. I hope I made myself clear. I hope with this few points of mine, I'll be able to convince you and not confuse you that I was shocked when I got to the NHS. Although I'm loving it. Don't get me wrong. Thank you so much for watching. I hope you enjoyed this video. I will see you again in another video. Please remember to like, subscribe, click on the notification bell, and I will see you again later. For now, bye.